Kids are much more likely to get ear infections compared to adults. When we think about why, one of the reasons is actually because of the anatomy that kids have of their ears and a structure called the eustachian tube that's different between kids and adults. So the eustachian tube is a structure that connects the ears and the nose. It actually opens into the back of the nose, and so we're actually able to see it, or the opening of it, if we put a little camera through your nose. And it has two main important functions. One is to keep fluid from backing up into the space behind the eardrums, and then the other important function is to open and close to equalize pressure between the outside world and the space behind the eardrum. So like when you're on a plane or driving through the mountains and you feel that popping happening, that's the eustachian tube opening and closing. So in kids, the eustachian tube is really narrow and it's also much straighter, whereas in adults, as we grow, the eustachian tubes get bigger and then they also get more angled down. The implication of that is that it's much easier for fluid to get trapped behind the eardrums of kids because of that difference in eustachian tube anatomy. Because of that, if fluid does get trapped behind the eardrums, it can be a breeding ground for bacteria and then can lead to ear infections, which is why kids are more prone to ear infections and potentially needing ear tubes more so than adults.